Hi, I'm Dr. Natalie Kather, a board-certified family practice physician in Olympia, Washington, and I have some important words to share with you on breast health. And those words are, we are doing this all wrong. We practically turn our world pink with pink ribbons, water bottles, bracelets, pink signs, and bumper stickers. But if we look closely, as valuable as those efforts are, the majority of the funding goes towards research for the treatment of breast cancer. New drugs, new surgeries. Women, let me ask you a simple question. Wouldn't you rather prevent the problem? Of course you would, but you would be surprised to learn that only a few pennies from every dollar raised from that last walkathon go toward prevention. Oh, they may say the money went toward prevention, but again, look more closely. What does prevention mean to them? It means more frequent mammograms. I'm sorry, but that's not prevention. That's early detection, which is a good thing, but where I come from, prevention means not getting the disease. So let's talk about that, preventing disease, because that's my specialty. That's what we do every day at Advanced Family Wellness. A vast majority of my female patients come in with this dread about breast cancer because they don't know what to do to prevent it. They don't know how to have beautiful, healthy, happy breasts. The reason for this became crystal clear to me one morning when I was at the airport on my way to give a lecture on breast health. I was at the newsstand and there it was in front of me, this huge wall of magazines. And as I looked at the men's section, of course, most of the magazines there had breasts on the front covers. Some of them had breasts that were partially covered. The ones, of course, that were fully bare with nipples showing had to be wrapped in black plastic. Ooh, can't see those. Oh no, no peeking. Now we could go into a debate about how this objectifies women or is degrading to women, but I'm not interested in that debate because breasts always have been and always will be titillating. Great word. What caught my attention was the women's section. Many of those magazine covers also had breasts on them. Now, it's not that we women want to look or peek at breasts because we can look in the mirror, right? It's because the magazine editors know that we are uneasy, insecure, and let's face it, obsessed about our breasts. How they look, how they feel, and of course, will I get breast cancer? In fact, many of the magazines had articles on breast cancer, but as I looked through them, the information was all pretty much the same. They could have been written by the same person. Recommendations were often maintain a healthy weight, get regular exercise, eat a healthy diet, no hot dogs, not too much alcohol, get an annual mammogram, and see your doctor about the latest drug. But come on, we all know ladies who have done this and they still got breast cancer. So there has to be something more for true prevention. So I'm curious. I go to the health section of the newsstand. There's even a magazine called Prevention. But as I thumb through the articles, it's all pretty much the same, with the added feature of a panacea food or magic fruit, always from some faraway land, very exotic, gotta have that. As if the women that drink that special tea or that magic fruit juice from far away never get cancer. So there it was, the great American boob job, selling you big breasts, perky breasts, selling us worthless information, selling you magic berry drinks, and listen to this, selling you fear. What I did not see was any real attention to the mountain of good research that's been done in the last 10 years that show us true breast health. This is the research that I review every week that can help us celebrate our beauty instead of flaunting it, hiding it, being ashamed of it, or fearing it. There is good information out there, but our society would rather sell you the illusion of health than to help you actually experience it. The final piece of this realization was when I stepped back and saw that many of the women's magazines had pictures of cakes, cookies, pies, cupcakes on their covers. And then I stepped back further and I noticed that next to the newsstand was a Cinnabon, and right beside that was a McDonald's, and across from that was a candy store. Sugar and fat increase the risk for breast cancer. So where do you go for accurate and cutting-edge healthcare that focuses on true wellness, on a process of creating and maintaining vibrant health? I want you to be so happy and healthy that you'll be able to just walk through an airport and smile. Advanced Family Wellness has programs for groups and individuals. We address a full spectrum of health concerns. We specialize in anti-aging and metabolism, sex hormone balancing, thyroid health, and nutritional therapy. Ooh, quick test. Here's a mammogram report. This says that this woman has benign fibrous calcifications in her breasts. Should she, A, be elated, she apparently doesn't have breast cancer, B, worried, there is some uncomfortable tissue in there, or C, proactive and ready to address this with a physician that specializes in women's health? If you answered C, then I'd love to see you at Advanced Family Wellness. I'm Dr. Natalie Kather. Thanks for watching.